Hello, my dear friends. I'm Dr. Vaishali Barambe. I've been teaching anatomy for more than 25 years and I love it. Let's talk about tubectomy or tubal ligation. Take a look. This is secondary oocyte. It travels to the ampulla. This is the sperm released in the vagina. It travels to the ampulla too. And when they both meet in the ampulla, there is fertilization and formation of an embryo. Tubal ligation is a method by which you prevent this. How do you prevent it? Let's understand. So we're going to prevent fertilization by carrying out the procedure of tubectomy. But for that, you have to understand how. Patency of these fallopian tubes is a crucial part of fertilization. So remember, note the importance of patency of entire fallopian tube. Right. So the luminal continuity I want to stress upon is this. This entire path has to be continuous. It has to be, there cannot be an obstruction in the lumen along this. Okay. Suppose the tube is blocked here. What would happen? Any sperm trying to enter through would get blocked here. That is the basic concept of tubectomy. I'll explain it to you further. But let's understand what is tubectomy, define it. It's a surgical procedure for female sterilization wherein the fallopian tubes can be blocked or severed. You can see it severed here. You can see it blocked here with the help of a band. So you're going to block the continuity of the fallopian tube or actually cut the tubes so that no fertilization can happen, no sperm can meet the secondary oocyte. Does the father continue to produce sperms? Yes. Does the mother continue to produce secondary oocytes? Yes. But they do not meet, and that is what is tubectomy. So there's some anatomical points you should always remember. One is that the fallopian tubes are muscular tubes medially attached to the uterus at the uterine cornua, laterally draped over the ovary. Remember the uterine cornua, the two lateral angles, superolateral angles of the uterus. Why do you have to remember all this? Because you have a very tiny little incision through which you're going to be doing tubectomy. So finding the fallopian tube becomes very easy if you find the uterus and just trace it laterally. The uterine tubes are enfolded by the mesosalpinx, which contains a lot of blood vessels. So these are the three anatomical points you must remember when you are attempting or trying to discuss tubectomy. So what are the types of tubectomy? Tubectomy has come a long way. Initially, it was an open tubectomy. Today, we do laparoscopic tubectomy. So you just put in a laparoscopic tube, find the fallopian tubes. Here, the incision in the patient's abdomen is quite small. You find the fallopian tubes and block them using surgical clips or rings. Open tubectomy needs a rather large incision, and of course the tubes are picked up, tied, blocked or cut. Okay. Mini-laparotomy is a surgical procedure which is somewhere using both the laparotomy as well as open tubectomy, often done immediately post delivery of women. Okay. So these are ways in which tubectomies are done. What kind of method is applied on the fallopian tube? You can apply clips as shown here. You can apply rings as shown here. You can electrocoagulate. You can cut and coagulate the two ends of fallopian tube, or you can excise and tie up the two ends of the fallopian tube. These are the techniques used for tubal occlusion. So how does tubectomy really work? Understand that these are the points where you have applied the tubectomy. Okay, so this is the release of the sperm inside the vagina. It reaches the blocked portion and the sperm stop. Parallelly, the Same thing happens on the other side as well. Both sides are blocked, okay? And then this is the secondary oocyte which is released and comes into the ampulla and it's waiting. Somebody will come and fertilize me. But can the sperm come? No. Why? Because there is tubectomy done. And this is the basic procedure of tubectomy. So now how will you write a note on tubectomy? You define it. You give another name for it, which is tubal ligation. Then you explain the basic process of fertilization. So explain how fertilization occurs and how the luminal continuity, basic physics of it is so relevant. Then you begin to talk about how the blockage occurs, okay, and it can lead to infertility. For the procedure itself, define tubectomy, define the anatomical landmarks, what are the types of tubectomy, what are the techniques of tubal occlusion, and finally, how does tubal occlusion stop fertilization? Okay, so if you're liking my lectures, do like and subscribe to my channel. Bye.